have got. Now, on the government, usually government makes the policies. So I thought I will tell you a little on this. Architectural correction of the health system has been taken up. Bottom-up planning approach, need-based planning, and equally providing essential human resources for health. That is the motto now. Well, we want, these are the people. At what facilities? Well, we have been successful in upgrading so many facilities and providing so many additional human resources. Well, the provision of human resources, now in last, just how much the performance increases, if you see. Deliveries have increased by 70% when you provide the human resources and upgrade the facilities. Well, now we can have the happiness of having facilities like this even in government sector. And these are all factual photos. Well, now coming to the human resources thrust, now we are going to, what are the issues which are going to be? We have to bridge the gaps. We have to increase the human resources in the especially rural areas and provide the human resources of good quality and sure that you should have, everyone should have the appropriate skills. And of course, supportive supervision of human resources for health. That is the critical. The initiatives what have been taken up, recent these are all. New cadre of rural practitioners. Bachelor of Rural Medical Practitioner, 3.5 years course has been proposed. We have plus, negative, so many views are there. We are not here to discuss on that. But Diploma in Medicine and Rural Healthcare in Assam, they have started in 2004. It has been successful. They are posted in the hilly areas and they are there working. Doubling up of the PG medical seats, most of them you will be aware. From 4,000 it has become 8,000. One simple policy that you take per teacher 2 students, not 1 student. Central government for support for new institutions. In the last 5 years, the nursing institutions and midwifery institutions have been increased from 1,646 to 5,222. Such a gross improvement. But how did it man? It has come from a policy. But these are all numerical. But how are we going to now come to the issues of quality, service delivery? Well, we are talking about human resources. The motivation, how are we going to increase? Competencies, how are we going to increase? The bottom two. These are the 2 key issues for the years to come. Now, many states have started incentivizing. If you want to go into a rural area, we will give extra this much, 50% more salary. A lot of incentives. I think somebody will be dealing with all these aspects now. Well, the quality issue. We have done quite a few studies, 6 studies across the states. It is so, disappointing that the ANMs who are supposed to conduct deliveries so less are competent. They have stated that I am not competent, I have not have the confidence to do. So quality in education, that is a big issue what we are facing. During lunch break, I was asking to youngsters, they feel that how much is the relevance of their medical education? Why they don't apply? So these are certain issues which I would like to have. Whatever it is achievement, I would say the overburdened health workers, whether it is a doctor or whoever it is, always stood up to meet increased demands. And pooling of resources we have been doing. Decentralization of powers. We are doing incentives for good performance. These are some of the achievements. But what are the constraints? Inadequate managerial support and supervision. This is what? Across the sectors. There are no indicators for HR governance. And there are no norms for accountability, individually and collectively. And, well, conflict of interest. That is it. So, I would like to just throw these issues open to you all, whatever it can be. Some of them coming through this, not necessarily that we are going to solve all these issues today. Well, I would like to quote, Dilip has made my introduction very simpler in the morning session while winding up. He said substantial policy changes are required to improve HRH, and this needs very high level political advocacy. And are we ready for that? Hopefully. And it is not a simple task because our states, each state, UP is as big as Brazil, Delhi is as big as Cambodia, population terms. Uttaranchal is equivalent to Austria, the smallest. So this is the status. So we are planning for the entire, so many countries like populations. So it is not an easy task. See, what I mean to say is, planning or implementation in India is not a simple thing. It varies across the districts. I am still happy. This is somewhere beyond Amarnath, Kargil sector. I was very happy to see even there, the sub-center has got 2 ANMs, health worker male, everybody. So we are progressing, and let us hope for the best. And today's discussions should throw much more on the quality and improvement of services. Well, thank you.